thanks for that question, Donna. So this is really important, right? Because hypertension and diabetes are both really common and they're both really serious conditions. But on the other hand, if hypertension management confers a protection against cognitive impairment dementia, that's good news because that's a lot of people at risk that we can do something to help. So earlier this year, the Sprint Mind trial, which was conducted by Dr. Baker's home institution, Wake Forest, published their findings, which said that for adults with hypertension but without diabetes, they didn't study people with diabetes because there is some evidence that if you have diabetes, that drastically lowering or aggressively lowering your blood pressure can be harmful in some ways. So that's an open question, but for people without diabetes but with high blood pressure, lowering the systolic blood pressure, so that top number, to 120, offered a 20% reduction in the risk of developing mild cognitive impairment or dementia independently, and then both of them combined. So they saw about the same effect size every time. So getting that systolic blood pressure down to 120, that's a goal. It's not achievable for everyone, but it really seems like that's helpful. There's also been some exciting findings regarding blood pressure medication recently that suggest that the timing of when you take your medication can make it more efficacious. So if you're taking a blood pressure medication, maybe talk with your physician about that. Would it be beneficial for you to consider taking that medication at night? For diabetes, as Dr. Wilcock mentioned, we're concerned about that. There's a lot of conversation in our field about whether diabetes is a risk factor for Alzheimer's disease or cerebrovascular disease, but we all agree that it's bad for your brain and it causes damage to blood vessels. And so if we have diabetes, we want to be really careful and attentive to managing our glucose, managing our HbA1cs. If we don't have diabetes, I have really good news, which is that exercise is a really big risk reducer for developing diabetes, also for hypertension. So exercise is going to be a really good broad spectrum medication. And we didn't mention cancer today, but there's also a lot of evidence out there that exercise is associated with reduced risk of cancer as well.
So just to clarify on the blood pressure, because this was actually one of the specific questions asked, is would there be benefit to going lower than 120/80?
So we don't know that. The evidence that we have about really low blood pressure in older age suggests that that's maybe not a good thing. So we don't have evidence that suggests that going below 120 would be helpful